ನಿನ್ನಲ್ಲಿ ಶರಣಾಗಿ ನೀ ನನ್ನ ಉಸಿರಾಗಿ ಮಾಡಿದರೆ ಸಾಕು ರಾಘವೇಂದ್ರ. ಹಾಲಲ್ಲಾದರೂ ಹಾಕು ನೀರಲ್ಲಾದರೂ ಹಾಕು ರಾಘವೇಂದ್ರ. ಹಾಲಲ್ಲಿ ಕೆನೆಯಾಗಿ ನೀರಲ್ಲಿ ನೀನಾಗಿ ಹಾಯಾಗಿರುವೆ ರಾಘವೇಂದ್ರ.
Let us thank our invocation group for the beautiful and inspiring invocation with a round of applause. Now I'd like to invite Netra to deliver the welcome speech.
ಎಲ್ಲರಿಗೂ ನಮಸ್ಕಾರ. ಇಂದಿನ ಈ ವಿಶ್ವ ಅಲರ್ಜಿ ಸಪ್ತಾಹದ ಕಾರ್ಯಕ್ರಮಕ್ಕೆ ಆಗಮಿಸಿರುವ ಎಲ್ಲ ಗಣ್ಯ ಅತಿಥಿಗಳು, ವೈದ್ಯರು, ಆರೋಗ್ಯ ಸೇವೆ ಪಡೆಯುತ್ತಿರುವವರು, ಅವರ ಕುಟುಂಬದ ಸದಸ್ಯರು, ನಮ್ಮ ಸಿಬ್ಬಂದಿ ವರ್ಗ ಹಾಗೂ ಆರೋಗ್ಯದ ಬಗ್ಗೆ ಕಾಳಜಿ ಹೊಂದಿರುವ ಎಲ್ಲರಿಗೂ ನನ್ನ ಹೃತ್ಪೂರ್ವಕ ಸ್ವಾಗತ. ವಿಶ್ವ ಅಲರ್ಜಿ ಸಪ್ತಾಹದ ಅಂಗವಾಗಿ ಕಳೆದ ಕೆಲವು ದಿನಗಳಿಂದ ನಾವು ಅಲರ್ಜಿ ಹಾಗೂ ಪರಿಸರ ಸಂಬಂಧಿತ ಹಲವು ಮಹತ್ವದ ವಿಷಯಗಳ ಕುರಿತು ಚರ್ಚಿಸುತ್ತಾ ಬಂದಿದ್ದೇವೆ. ನಾವು ಹವಾಮಾನ ಬದಲಾವಣೆಗಳಿಂದ ಉಸಿರಾಟದ ಅಲರ್ಜಿಗಳ ಮೇಲೆ ಉಂಟಾಗುವ ಪರಿಣಾಮಗಳು ಮತ್ತು ಅವುಗಳಿಗೆ ಅಗತ್ಯ ಆರೈಕೆ ಎಂಬ ವಿಷಯದ ಬಗ್ಗೆ ಅಮೂಲ್ಯವಾದ ವಿಚಾರಗಳನ್ನು ತಿಳಿದುಕೊಂಡೆವು. ಹವಾಮಾನ ಬದಲಾವಣೆ ಎಂಬುದು ಕೇವಲ ಪರಿಸರದ ಸಮಸ್ಯೆ ಅಲ್ಲ, ಅದು ನೇರವಾಗಿ ನಮ್ಮ ಆರೋಗ್ಯದ ಮೇಲೂ ಪರಿಣಾಮ ಬೀರುತ್ತದೆ ಎಂಬುದನ್ನು ನಾವು ಅರ್ಥ ಮಾಡಿಕೊಂಡೆವು. ಇಂದು ಆ ಚರ್ಚೆಯನ್ನು ಮತ್ತೊಂದು ಹಂತಕ್ಕೆ ಕೊಂಡೊಯ್ಯುವ ವಿಷಯವನ್ನು ನಾವು ಆಯ್ಕೆ ಮಾಡಿಕೊಂಡಿದ್ದೇವೆ. ಇಂದಿನ ವಿಷಯ ನಿಮ್ಮ ರೋಗಿಗಳ ಮೇಲೆ ಹವಾಮಾನ ಬದಲಾವಣೆಯ ಪರಿಣಾಮಗಳನ್ನು ಹೇಗೆ ತಗ್ಗಿಸಬಹುದು. ಇಂದಿನ ಕಾರ್ಯಕ್ರಮವು ವೈದ್ಯರು, ಆರೋಗ್ಯ ಕಾರ್ಯಕರ್ತರು, ಆರೋಗ್ಯ ಸೇವೆ ಪಡೆಯುತ್ತಿರುವವರು ಮತ್ತು ಕುಟುಂಬದ ಸದಸ್ಯರಿಗೆ ಈ ಸವಾಲುಗಳನ್ನು ಎದುರಿಸಲು ಅಗತ್ಯವಾದ ವಿಚಾರಗಳನ್ನು ತಿಳಿದುಕೊಳ್ಳುವ ಒಂದು ಉತ್ತಮ ಅವಕಾಶವಾಗಿದೆ. ಹವಾಮಾನ ಬದಲಾವಣೆಯನ್ನು ನಾವು ತಕ್ಷಣವೇ ನಿಲ್ಲಿಸಲು ಸಾಧ್ಯವಾಗದಿರಬಹುದು, ಆದರೆ ಅದರ ಪರಿಣಾಮಗಳನ್ನು ಕಡಿಮೆಗೊಳಿಸಲು ಮತ್ತು ಆರೋಗ್ಯವನ್ನು ರಕ್ಷಿಸಲು ನಾವು ಕೈಗೊಳ್ಳಬಹುದಾದ ಕ್ರಮಗಳ ಬಗ್ಗೆ ಇಂದು ಚರ್ಚೆಯಾಗಲಿದೆ. ಈ ಕಾರ್ಯಕ್ರಮದಲ್ಲಿ ಭಾಗವಹಿಸಲು ಆಗಮಿಸಿರುವ ನಿಮ್ಮೆಲ್ಲರಿಗೂ ಮತ್ತೊಮ್ಮೆ ಹೃತ್ಪೂರ್ವಕ ಧನ್ಯವಾದಗಳನ್ನು ಸಲ್ಲಿಸುತ್ತೇನೆ. ನಿಮ್ಮ ಉಪಸ್ಥಿತಿಯೇ ಈ ಕಾರ್ಯಕ್ರಮದ ಯಶಸ್ವಿಗೆ ಕಾರಣವಾಗಿದೆ. ಇಂದಿನ ಉಪನ್ಯಾಸವು ಎಲ್ಲರಿಗೂ ಉಪಯುಕ್ತ ಮಾಹಿತಿಯನ್ನು ನೀಡಲಿ, ಹೊಸ ಚಿಂತನೆಗಳಿಗೆ ಪ್ರೇರಣೆ ನೀಡಲಿ ಹಾಗೂ ನಮ್ಮ ಆರೋಗ್ಯ ಸೇವೆ ಪಡೆಯುತ್ತಿರುವವರು ಉತ್ತಮ ಆರೈಕೆಗೆ ಮಾರ್ಗದರ್ಶಿಯಾಗಲಿ ಎಂದು ಹಾರೈಸುತ್ತೇನೆ. ಧನ್ಯವಾದಗಳು. ಮತ್ತೊಮ್ಮೆ ವಿಶ್ವ ಅಲರ್ಜಿ ಸಪ್ತಾಹದ ಇಂದಿನ ಕಾರ್ಯಕ್ರಮಕ್ಕೆ ನಿಮ್ಮೆಲ್ಲರಿಗೂ ಆತ್ಮೀಯ ಸ್ವಾಗತ.
Thank you, Netra, for your warm words of welcome and for setting the tone for today's program. Now I'd like to invite Ramya to introduce our speaker for today's session.
Good afternoon, everyone. As part of our 5th day celebration of World Allergy Week, I warmly welcome you all. It's a great pleasure to gather here to create awareness and share knowledge about allergies and their impact on health. It's my great honor and privilege to introduce our estimated speaker, Dr. Saud Ahmed. He is a highly accomplished ENT, head, neck, and skull-based surgeon with extensive experience in advanced otolaryngology and patient care. He completed his MS ENT from the prestigious CMC Vellore and holds multiple fellowships in allergy and immunotherapy, sleep surgery, and skull-based surgery. Dr. Saud currently serves as a managing director and CEO of Excel ENT Clinic, Bangalore. He is also associated with leading hospitals as an consultant, ENT surgeon, and department head. Along with his surgical excellence, he has made significant contribution to academic research and medical education. His expertise includes sleep medicine, allergy disorders, advanced ENT procedures, and skull-based surgery. He has published several research papers and actively mentors students and healthcare professions. Today, we are fortunate to learn from his valuable knowledge and experience. Please join me in extending a warm welcome to Dr. Saud Ahmed.
Thank you, Ramya, for introducing the speaker. Now, as a token of our appreciation and gratitude, we would like to present a gift to our guest speaker. May I request Dr. Nagendra Prasad sir to kindly forward. Okay, we now invite our esteemed speaker to address us on today's topic. Sir, the stage is yours. Yes, sir, Madhumita.
Okay, thank you. Okay, am I audible? Yeah. I request the audience if you can occupy this one more seat here. One person can come here and another person can also come here. First and foremost, I would like to thank my teacher and my mentor, my guide, Professor Dr. Nagendra Prasad sir, for inviting me for this World Allergy Week and giving me an opportunity to speak on the topic which we are going to discuss very soon. I've learned a lot. Whatever I am today, whatever knowledge I have, my skills I have, all I'm indebted to sir. And this place, Bangalore Allergy Center, where I did my formal training in allergy for almost 1 year. That was about 5 to 6 years back. And all the staff here have helped me. They've been very helpful. Very lot of familiar faces that I can see, and some new faces as well. So the thanks continues. Every time I come here, I keep thanking, and I think I can never fulfill the rights that this place has given me as far as allergy practices. Thank you so much, sir. Dear participants, welcome once again to World Allergy Week. So today what I'm going to speak is about the effect of climate change that it has on the health conditions of our patients suffering from allergic disorders, and what we can advise them in order to reduce the burden of the climate change. As we all know, we are moving towards industrialization, modernization. So as a result of that, we have certain benefits and we also have certain drawbacks of progress that we are making towards industrialization. And one of that is climate change, increase in the temperature that we all know. So what happens when the temperature increases? A little bit background about allergy. I'm sure most of you know. How many patients over here? 3. Okay. And the remaining are staff? Any doctors? Oh, good. All right. Okay. So what are the main allergens we need to understand in the environment? When these allergens come into contact into our nasal mucosa or our bronchial mucosa, we start having allergic rhinitis and asthma. So basically 5 categories. One is pollen grains. Pollen grains are present in the trees and the plants. They shed pollen. They are powdery substances which freely move in the air. When we breathe it, we start having rhinitis and asthma. So that's pollen grains. Then we have dust mites. These are microscopic insects present in the dust, mainly indoors. We also have insects causing allergy, like moth, housefly, mosquito, cockroach, along with this mold, the mold that we see on the walls, on the tree barks, in damp conditions. These molds also trigger allergy reactions, and we all have pets like cat, dog, buffalo, cow. So their dander also causes allergic reactions. So when we're talking about climate change, let's start relating it with pollen grains first. So when the temperature increases and the length of the summers increase, what happens? The pollen season also increases. The pollination also, the length of pollen period. Normally, every plant has got a pollen period. For few months, they shed pollen, and some are perennial that they shed throughout the year. But the ones that are seasonal, because of the extended season, pollination season, the number of pollen grains increases. Number one, and number two, so ultimately the concentration also increases in the environment, and the concentration of pollen grains and their allergenicity, that means their potency also increases because of high temperature. So all these combined increases the pollen load, and that people who are sensitized to pollen especially, for them it causes an exacerbation in their symptoms. This is we need to understand the relationship to pollen grains. Similarly, people who are, so who are the vulnerable population in this? Who are the vulnerable? Vulnerable are people usually who are working outdoors, like we have farmers and people who are working in the fields, the laborers. They get exposed to pollen. Even indoors, when we keep the windows open, when we keep the doors open, the pollen grains can come in and can aggravate the symptoms in those predisposed individuals. So first thing, as doctors, we have to identify and educate the vulnerable population. People are working outside. And see, there is in India. I'm not sure if we have this pollen calendar. But we have the pollen calendar, but we don't have a public broadcasting like an alert system for pollen. Is it there, sir? No, I don't think we have it at our national.
There,
Okay, sir.
in times of India,
In times of India
a
Institute.
couple of years, from
Okay.
84 to 92, was there. Then there was.
Yeah. So in the US and European countries, for example, in US we have this National Allergy Bureau (NAB). So they have this regular. Whenever the pollen count is high, they have the public announcements saying that the pollen count is high. So try to people who are predisposed to asthma, stay indoors or limit your outdoor activity. So they give up. So people, obviously pollen is something we cannot see, and a common man cannot will not know, like what are the seasons where the pollen count is high. So here we have some alarm like in Delhi and all. When the air quality goes poor, they give an alarm. Like the air quality is going for that. We can all see people will be suffocating. The hospitals beds will be getting filled. So auto will come to know. But then this is happening in the Europe and in US. So even in Australia, where so but in India we don't have that public announcement system. So there are, for people at least who are educated, there are certain apps available, like something called as an Ambi app, and there's some other apps where you can see the local area and what are the pollen, how are the pollen concentrations, when are they more, and your physician, the allergy physician with whom you are in touch with, also can guide you a little about the area and about the pollen. So once we understand the vulnerable population, we need to educate them that these are the seasons, this is how it can aggravate your symptoms, and we can at least give them some guidelines, give them some advice as to preventive measures. Preventive measures. Before I go to the pharmacotherapy, preventive measures like people who are, say, for example, now there's work from home. People can work from home. So there is an asthmatic who's on regular medicines, and he knows that this certain seasons the asthma goes up. Rather than just increasing the dose of the medicines, we can counsel them to take an option if they can work from home, so that they can limit their exposure outside. Similarly, people who are at home, they can try to keep the windows and doors closed during the mid-morning hours, during the early evening hours, where the pollen count is high and when the breeze is there, so that the concentration of pollen indoors reduces. Similarly, one is about working from home. One is limiting the exposure. Supposing somebody has a habit of going for walks every morning, they go out to the garden, to the parks, to take a walk, or they have a habit of cycling. We cannot ask them to stop their activity because they've been doing it for several years. One option we can do is that do the exercise indoors or join a gymnasium where you can practice these things within a closed environment where you'll not be exposed to the pollen. So this is something, these advices we can give them. And now coming to the medicines, as far as the medicines is concerned, what happens is during the pollen count is high, many clinicians we experience, and even the emergency department, they land up in the emergency department with acute exacerbation of their asthma. And then we will have to step up their management. Many of them would not have been taking their controller medicines. Controller is something that the doctor would have advised the asthmatics to take on a regular basis, irrespective of the symptoms. So these are usually corticosteroids which have to be taken on a regular basis. And then there's something called as reliever medicine. Reliever is whenever there is an acute wheeze, or when there is acute symptoms. That time for a few weeks we give reliever medicines. So what is we see in the hospital setup is people land up in the emergency department with severe wheezing, and when you take the history, they would not have been taking any controller medicines. They would have been documented. Yes, we are asthmatics. We have been having wheezing in the past, but this year, last 3 months, we have not taken any inhalers, and now they've landed in this situation. Now to stabilize them, sometimes you have to give them a little bit high dose of steroids, keep them inpatient, stabilize them, and then discharge them after a few days. And very rarely, sometimes they even need to get into ICU admission. All this can be prevented beforehand if we know that the pollen season is coming, it's going to be high, and they should be educated to use their controller medicines regularly. It's very important. That's why when a medicine course is prescribed for 3 months, people in our Indian scenario, after 1 or 2 weeks, once the symptoms are under control, they leave it. They do not take the controller medicines. But this long course of 3 months, I'm sure, sir, you also give for 3 months, is it? Before stepping up and stepping down, your prescriptions are generally for 3 months, isn't it, sir? Yeah. So that 3 months course is only to prevent exacerbations. Okay, so we as patients, we should be able to take that whole course so that our exacerbations are under control, and we don't land up in severe situations. And that is something we'll have to do as the pharmacotherapy is concerned. And this is one thing as far as pharmacotherapy is concerned. Along with this, certain other measures like using masks is a good habit. We've got certain, now with the COVID has taught us so much about masks. So we know about that N95 mask, which is a slightly more complex mask, which will even filter the minute particles. So that can be utilized whenever we are going out, and adding to that, air pollution. See, what happens is when the temperature goes up, the reason for that is because of carbon dioxide, ozone increasing, and then carbon. A lot of gases are there. So with the gases, with these environmental pollutants, particulate matter, adding to that the pollen, everything adds on. It's like a additive mixture to increase the symptoms. So when we use masks, when we use simple things like washing hands, and when we come back from outdoors, changing our clothes, and wearing indoor clothes, and washing our clothes in slightly higher temperature, ironing them, all this deactivates protein matter. We cannot 100% eliminate it, but at least to some extent, that protein can be denatured and its allergenicity can be reduced by doing these simple things. Keeping pets outdoors, because pets, when they go out and come, they have sticky hair, their fur. The pollen tends to stick to their fur, and not only so many patients will tell us, no, we are not allergic to pets, we are not allergic to dogs or cats, but their fur has got dust mites. The fur has got pollen grains, especially if they are going out. So they need to be kept out, especially in the places where we are sleeping, where we are dining. They should not be encouraged to come there. They should have a separate area for the pets. So I spoke about masks, and similarly, humidifiers are available. So if somebody says we have to close the windows, close the doors, how will we breathe? There's no ventilation. So air conditions, people who can afford air conditions, humidifiers, these are certain things that can help us reducing the allergen burden inside. And like I was talking to you about controller. Now, if the person is a known asthmatic, and every year and year he's taking controller medicines, that is not going to modify the disease. It is not going to modify the disease. Only disease modifying therapy is something called as allergen immunotherapy. Remaining all the medicines that are available, whether it is tablets, pills, whether it are nasal sprays, whether they are inhalers, all these are only temporary measures to give us relief on a temporary basis. It will not help us cure the disease. But the new methodology, it is almost more than 40, 50 years old, and it's now probably this concept came almost 100 years back. It's not a new concept about allergen immunotherapy, which this center is specialized in. So that is the only available method by which we can modify the disease and try to give like a vaccine, try to give a complete relief from symptoms. So for that, we have to do a simple test called allergen skin prick test. Now I told you about pollen. How will a common man know that I'm allergic to pollen? Whether it's parthenium, whether it is some cynodon like another grass, or whether it's a neem tree, whether mango tree or coconut. How do we know? We do a simple test after taking history. The allergy physician will order a skin prick test. So based on the skin prick test, we can come to know along with the pollen, which kind of pollen, and also whether there are dust mites involved, whether there are insects involved, mold, or any pet dander. On that basis, on the basis of the response to the skin prick test, the allergy physician will be able to customize certain medicines. These are customized medicines. They are not medicines available in the pharmacy. Like I cannot go and ask for immunotherapy in the pharmacy. These are customized medicines based on the skin prick test report. Those allergens are selected pollen, and they are given in low dose quantity in a sublingual form under the tongue. Injections are also available, but under the tongue, these strips are very convenient to use. And children also can use it. Children are scared of injections. So we can start giving immunotherapy from 5 years of age, in 5 years of age onwards. The problem is when they come at 40, 45, 50, after suffering the whole life. It is not difficult, I would say, but there is something called as airway remodeling. That means the airway has got thickened because of continuous attacks of allergens, wheezing, asthma. It has got thickened, so the response to immunotherapy will not be so great. Even the rhinitis. So when they are young, from 5 years, 10, 15, 20 years, when we are able to identify them at a younger age, and then we start them on this immunotherapy, the result will be better. And also the progression of symptoms is taken into control. For example, if somebody is having rhinitis at the age of 15 years, rhinitis means allergy of the nose. So that individual can become an asthmatic at the age of 25, 30 years. There are chances. If we start immunotherapy at the age of 15 years, the chances of that individual becoming an asthmatic is going to go down. So much of benefit we are giving, isn't it? It's called allergic march. We are trying to halt the allergic march or delay the allergic march. So that's why younger individuals, this awareness has to go in the community. The moment, even today, a lot of GPs, a lot of pediatricians, the moment a child at the age of 5 years, 8 years goes with asthma, unfortunately, because of lack of awareness, many pediatricians also do not talk about this concept of immunotherapy, about trying to identify the cause. They will give medicines which are very much required in the form of nebulization or inhalers or tablets. But what we are trying to go towards is complete cure, or trying to give complete solution and disease modifying solution for the problem. So we are in our community, in our relatives, in our neighborhood, in our families. If we come across such children who are having allergic symptoms, or youngsters, they should be encouraged to meet an allergy physician who can do the allergy skin prick test. And based on the results of the allergen skin prick test, we can customize the medicines of, like I told you, sublingual. It's very convenient. And what happens once you start taking that? For example, I give an example like this to my patients also. Supposing my friend Zain here, he's allergic to rose. Giving a very hypothetical example, a rose flower. So wherever a rose blooms in the garden, he starts sneezing. The gardener, he starts sneezing. So I call him, and then he tells me, sir, I'm allergic to rose flower. Whenever it blooms, I start sneezing. So I do the test and I confirm, yes, it is allergic to that particular thing. Then the rose petal the rose flower around, I don't know, maybe, no, it's wrapped and wrapped and wrapped. No, the rose one, it has got more petals, maybe around 100. Let's take it as 100 average, okay? So I call Zain and I take one petal and I tell Zain, you please smell this. So he will smell it, and bit of sneezing, no runny nose. So I'll say, okay, very good. Your work is to come to my clinic, something to smell. You have to keep smelling. So next day when he comes, again I'll give him one petal to smell. Again he's smelling. And he says, now do you have any problem? I ask him. He says, no, that yesterday itching also has gone. Very good. So 1 week he comes, he's smelling one petal. Then the next week I call him, I give him two petals. Then he's like smelling two petals the next week. And I asked him, yeah, a little bit of itching, otherwise no major problem. So another week, we give him 2 petals to smell. And then gradually every week he comes, I will increase the petals. And after 2, 3 months, he comes to me. He's sitting in my chamber with half a rose, almost half a rose. He's smelling it. And then I ask him, "Are you having any problem?" He said, "No, I don't have any problem." And slowly, after 1 year, I meet Mr. Zain. He's coming with a garland of roses. Okay, he's coming with a garland of roses and he's not having any symptoms. And that is what happened. I explained to him, this is what is immunotherapy. You are increasing your tolerance. Before you were not tolerant to your rose, not tolerant to the rose. Now you have become tolerant. So we have modified the disease. Now your immunity has increased. The same thing we do for dust mites, for pollen grains, for mold, for insects. So it's the same principle is involved. We are increasing the tolerance level of the individual. So it is completely natural. We are not giving Mr. Zain any antibiotics. We are not giving him steroids. We are not giving him medicines with preservatives and coloring agents. It is the same natural thing that he's allergic to, which is the same rose flower. And he's very happily taking it because it's natural. If I told him to take some chemicals, he deals with organic food and he has a business with all chemical free and organic, all those things. So he will say, I don't want any chemicals. Even if he's not an organic, any normal person will not want to take chemical based medicines for 1 year, 2 year, 3 years, 4 years. So allergen immunotherapy is safe, it is natural, it can be taken for a long time. It needs time. We cannot have immediate results like a cetirizine tablet or like Allegra, like any other antihistamine. Immunotherapy takes time. It takes 6 months at least for the effect to start. Sometimes 8 months, sometimes 1 year. So we have to be patient. Along with our medicines, we should use immunotherapy and use the preventive measures also. And after 1 year, slowly when the improvement starts, the patients themselves gain confidence. And they will. It is recommended that we take it for the whole 3 to 5 years, at least 3 years. But for best results, we should take it for 5 years at least to give a long-standing relief. So this is in brief about climate change, how it impacts pollen grains, and when the climate increases, even the mold increases when it's hot, when it's humid. So, like I told you, that it has a bearing on a lot of other allergens as well. But I gave you a small summary, small like a nutshell. I explained about what we can do. And anybody working in the government here, government agencies, no? We are working with the government, sir. Yeah. So we have to, as allergy physicians, we have to work with the government agencies to implement some policies like this. With the relevant government agencies about the pollen calendar and about this pollen announcements. We can do it. At least people who are educated will be able to follow that the pollen announcements, and they can stay indoors and take the appropriate measures. And anything else, sir? Would you like to contribute to today's topic, sir, that I've missed? You can also please come and share your views, sir. So, any other points regarding climate change?
What is pollution and what are the contents that we
Yes.
and how it is affecting the body?
Pollution. Yeah. So, pollution has got they are pollutants like carbon monoxide, carbon dioxide. So, what happens is carbon dioxide again. Increasing carbon dioxide will increase the vegetation, and unnecessary antigenic plants, weeds, they start growing in numbers, and they get into the residential areas, they get into the places where there is human dwellings, they start growing over there, and then they can have an impact on asthma and allergic rhinitis. And directly carbon monoxide, carbon dioxide, they have a detrimental effect on our health as well. So patients with COPD, they can have frequent exacerbations, and pollutants can cause, we are all well aware, especially the components are carcinogenic. They can cause cancers of the lung, cancers of the airway, starting from the nose, sinuses, paranasal sinuses up to the lung. And even air pollutants have been linked to even bladder cancer. So there is no part in the body that is safe when the load of pollutants, when the load of chemicals in the environment goes on increasing. So therefore, these are the direct and indirect effects of the environmental pollutants on the body. So anything else, sir? Apart from this?
Pollen counts in
Yes.
and the content of the whole list comes out. That
Yes.
becomes more virulent for the immune system.
Yes. So when there is thunderstorm, like sir was saying, during thunderstorms, the pollen split because of the electric energy in the environment and the heat. The pollens, they split and their proteins come out earlier than expected, and then that aggravates the symptoms.
The fungal spores, because of the humidity,
Yes.
the fungal spores comes out. That induces.
Fungal spores also, they like to they flourish in a humid environment. So when there is more humidity, the fungal spores increases. That is also going to add to the allergic burden. Any
Okay,
questions we can take? Sir is there. We can also answer any.
everyone give a big round of applause for Dr. Saudamar sir. Thank you, sir, for presenting how to mitigate climate changes on patients. Thank you very much, doctor, for the insightful and enlightening speech. Thank you. We'll now open the floor for questions. Anybody questions?
ಏನು ಮಾಡಿದ್ರಿ ದುಡ್ಡು ಮೈಸೂರು 9 ಹೌದು Correct. ಚಿಕ್ಕ ವಯಸ್ಸಿನಲ್ಲಿ ಹೆಲ್ಪ್ ಆಗುತ್ತೆ ಸಪೋಸಿಂಗ್ I don't know, you'll have to groom it properly. Dogs and naigaliಗೆ you'll have to groom it properly. Avoid all these allergens like I told, pollen and other dust mites from them. So the concept about this is called something called as hygiene hypothesis. Hygiene hypothesis means when the children are small, they should be encouraged to interact more with the soil, with the farm animals, domestic animals, poultry, cats, dogs. So they have a lot of microorganisms in them. Cats, dogs, poultry animals, goats, sheep, soil. So when there are more of bacteria in the environment, this bacteria, friendly bacteria, increases the immunity of the body. So that way it helps. But if somebody is already allergic, then you'll have to keep it away. You want to add anything to that, sir, about dogs?
Yeah.
Not a mic.
The immunity of the child, it starts after the 2 years. After the 2 years, she is based on the maternal, that is mother's immunity to the milk and other food environment. So that you are giving protection to the child up to the 2 years. After 2 years, it is exposed to the environment and they start learning the bacteria, the virus, and other organic materials. In this process, what happens? The baby gets one or two viral infections that will boost the immune activity. So baby should have one or two fever after 2 years, and that will boost the immune activity. And similarly, when they expose to the environment, as you said, expose to the animals, maybe in the farmhouse or maybe in the village environment, they'll be having a lot of cattle feeds, and these cattle feeds will be having a lot of the epithelials, the bacteria, the virus, which slowly sensitize the human body so that they become more tolerant. Now we have got only essential babies, one baby or a two baby. They are given more protection. They are not allowed to touch the soil. They are not allowed to play with the soil. They are not allowed to go to the environment. So with this protection, baby doesn't know that particular, the body of the baby doesn't know that particle has to be defensive or not. For example, you are keeping the baby exclusively in the room, not allowing in the family to spare or doesn't know. The moment it comes out, the baby is very astonishing. Who is this? Who is that? Who is that? Similarly, the immune system also has got a system to recognize that bacteria or a virus and to defend. That defending has to be done